years, we've had a conversation as a country to squeeze out price inflation when it comes to doctors and hospitals and health plans. I'll just mention, for doctors, there's tremendous transparency required under Medicare. For hospitals, there's tremendous transparency required under OSHPD and the ACA. Health plans have to reveal their medical loss ratios, but there's just not only is there not transparency, we just don't know answers. We have no idea. In fact, as policymakers, we really can't get at what other agencies contract with and negotiate. So do you have any thoughts about whether price transparency could help?
I've been doing a bit of thinking about that one. For starters, we're not unusual in that we don't have a lot of transparency going on. It's very hard to find a place in the world where there is a drug company that is explaining how they arrived at their price and saying that is the actual price. So I've always thought there might be something inherent in the way the system is structured to be built in such a way that it's not transparent. That said, again, from an academic perspective, there may be some advantages, and I know I'm not supposed to be saying this now, but there may be some advantages to lacking transparency. In some situations, for some payers that may afford certain discounts. But it makes it very difficult to be efficient when some of that information is missing. So it's a little bit of a choice between two decisions that are about things that could be quite difficult. The transparency would help. However, when I look around the world, I don't see any of it. So I sometimes wonder, well, what's the best we can do without the transparency? And sometimes I wonder, it's not necessarily the transparency, but it's the thinking behind the transparency and the idea that one must justify how we're arriving at what we're arriving at.
And I think just to conclude, and I appreciate the answers, this is one of the very few industries where it's both a monopoly and we don't have transparency around costs. When there are other monopolies in the economic marketplace, typically policymakers are able to gather costs so that we can provide a fair rate of return, right? That's true with utilities and other monopolies. That's not the case here. And again, I appreciate your answers. We will keep mulling over them.
Mr. Thurman.